Hi, I'm Dr. Rocco Piazza, board-certified plastic surgeon in Austin, Texas at the Piazza Center, and I'm so glad that you could join us this evening for this special event. This event is to kick off the holidays for you and for us, and it is about a gift that we want you to keep on giving, or at least give to you for the entire year of 2022. In 2019, we launched a technology called BBL, created by Cyton, that stands for Broadband Light. Broadband light is the #1 most effective treatment you can do to reverse sun damage, brown spots, redness or rosacea, and other skin changes that happen as we go through the decades of life. As we move through these decades, we accumulate sun damage. Our skin no longer looks radiant, light reflective as it did earlier in our life, and it starts to look dull. So BBL is the very best treatment you can do, minimizing your downtime or social downtime or downtime from work, and also create the most radiant and light reflective skin. With that being said, I'm going to tell you a little bit about why BBL is so important to us. In 2019, we researched heavily the very best light technologies in the industry that would help you to have the best looking skin. Prior to 2019, we had in our practice intense pulse light or photofacial therapy. And while this is a good therapy, it became an antiquated therapy. Cyton's BBL is the most advanced technology when correcting these changes of environmental damage in our skin, and it does it very quickly. Stanford looked at this information, in particular looked at the results of patients that had had broadband light treatment and found that these patients with consistent treatment of up to 2 to 4 times per year had the most youthful and radiant looking skin. And actually that these patients who were consistent with their results over the course of an 8 to 9 year period had all prevented aging over the last decade. And that's a big deal. And that's what caught our attention when we brought this technology into our clinic in 2019. Fast forward to now, 2021, Cyton created what's called BBL Hero or BBL Plus. It's 4 times faster than traditional BBL treatment. And this allows us to do a more effective job at treating areas of the arms, the full face and neck, the décolleté, and the rest of the body to remove unwanted hyperpigmentation, redness, and other signs of aging or sun damage. This to us is why BBL is so important. And now we have the technology to be able to help you achieve BBL Forever Young quality results anywhere on the body. So what I want you to do today is pay attention to everything that we tell you. It is really the most exciting technology that we have in our practice. And what happens with each treatment continues to reverse the sun damage, reverse the aging over the course of months to years. Consistent treatment is the key, though, to defying age. So I hope that you really enjoyed today's discussion as we take you through this technology, how we apply it to the head, face, neck, chest, body, and really enjoy today. If questions come up at any time, please enter them into the question or comment box. We'll be glad to review those with you live in person at the end of our discussion today.
So the question is what is BBL? BBL stands for broadband light. It's a laser-like light source that its goal is to rejuvenate the skin. It specifically treats hyperpigmentation, so people that have sun damage or sunspots, some freckles, but it also treats redness, people that have rosacea or broken capillaries, or the little cherry angiomas that people form. So what is BBL Plus? We brought on BBL Plus because it's 4 times the speed, it's 3 times the power, but it also has twice the cooling. And what that means for the patient is we get your treatment done faster, more efficiently, it's more comfortable, but you also get more added benefits, more anti-aging. We also have BBL Hero. BBL Hero is what we use to treat body. So when you want to treat your chest, your arms, your legs, we can bust those treatments out super quick, but also very safe and very effectively. A big reason why we brought BBL into the practice is not only is it safe and effective, it's great bang for your buck. So as a patient, when you're spending money, you want to see results. So I don't know if you know this, but we are actually the #1 provider of BBL in all of Austin, San Antonio, and Louisiana. So we actually had to bring in another device because we do so many of these procedures that we wanted to have opportunity for our patients to get in a timely manner, but also get great, amazing results. So the areas that we can treat with BBL include the face, the neck, the chest. A big thing is hands. People forget to treat their hands. That's one of the areas that can age people and they don't think about treating. But with the Hero, we can also treat arms, we can treat legs, we can treat back. We can basically treat you from head to toe in under 45 minutes. So when it comes to whoever's a great candidate for this, I would say that there's several different layers to this. Obviously, anybody that's got sun damage, I would say that's our #1 patient that we treat with BBL. We treat a variety of skin types. You know, as you get a little bit darker, we have to be more safe and gentle with the laser. We don't want you getting a lot of sun beforehand, so obviously somebody that's just gone to the Bahamas last week, we don't want them coming in and doing laser on their face. But anybody that's got hyperpigmentation or rosacea, they're usually great candidates for this. There are a few exceptions. People that have melasma, this is not the best option for them. However, we do have great options such as Moxie that we offer in our office to treat those conditions. We'd love for you to come in and let's consult and we can get a game plan together for you. So we also have patients that maybe have already done their corrective phases with BBL. Maybe they've already done a series of 3 or 4 and they've corrected whatever pigmentation issues they have. But what's great about BBL is there's also anti-aging properties to it. So it's going to keep your skin looking healthy, radiant, just where you're not having to cover things up with makeup. It's great for prejuvenation and just keeping those cells in a healthy state. So another common question is, when do I start to see results? So typically if we're treating hyperpigmentation or brown spots, those brown spots usually peel off in about 7 to 10 days. They just naturally slough off when you wash. They don't peel off like a sunburn or anything like that. So you're gonna start seeing some results within a couple of weeks after having your treatment. We typically schedule them about a month apart, so you're already seeing results from your first one by the time you come back for your next one. So there is one product that we typically put patients on. If we can do it a couple of weeks ahead of time, it's called Elastin Skin Nectar. And basically that just clears out all the old dead collagen and makes new collagen start forming. So that way when we do your procedure, you have less downtime. Typically, I wouldn't say that you have much downtime with this procedure. Anything that's brown is accentuated and anything that's red is accentuated. You can still put on makeup, you can put on sunscreen, and you can still go about your normal day-to-day business. We use the nectar post-treatment as well because it also has a little bit of arnica for anti-inflammation in it. So when it comes to BBL, we typically have different approaches for different people. Usually we like to set you up on an annual skincare program. So for some people that are just starting their skincare journey, we're in a corrective phase. So we typically treat you several treatments 1 month apart, 3 to 4, depending on how much damage you have. And then after that, we go into kind of a maintenance phase. We like to see you at least once a quarter. So usually, 4 in a year usually helps maintain those long-term results, along with good sunscreen and medical grade skincare at home that helps maintain your long-term results.
Thank you very much for attending our virtual event today. We are so very excited to share this information about broadband light, or BBL, and how this can really help you as we move forward in 2022. We believe that this quarterly treatment is the single very best thing you can do for your skin, and we're so excited that you wanted to learn about this today. We will be announcing product giveaway winners via email in the coming days, so please pay attention to your email. We're so excited to share a product with you because we know that medical grade skincare really enhances your results. Also, we ask that you stay today for our Q&A. Place your questions in the question box and we'll be glad to answer those for you live and in person today. In addition, you'll receive a text from us for your consultation. This is a complimentary consultation to do a VisiaSkin analysis on your skin, assess where we're starting, and to create your BBL plan. So say yes when you get your text. Thank you again. Hey, how are you?
Hello.
We're so glad you guys attended tonight, and we are here to answer questions for you. I'm Rocco Piazza, board certified plastic surgeon at the Piazza Center. This is April Daniels, nurse practitioner, who you saw in the video, and I think did an excellent job of really educating on the power of BBL Plus and BBL Hero. And we want to take the time to answer your specific questions that you have. We do have some questions that have popped into the box already, and I know one of the big hot topics is melasma. You touched on that, April. Can you elaborate a little bit about BBL and melasma and why we use Moxie and how effective that is?
Yeah, so, people with melasma, it's a different type of pigmentation. It's not just from sun. Melasma it can be complicated. We have brought on new technology this year called Moxie. And Moxie works wonders for melasma. Usually with BBL, it can sometimes make melasma worse. So really for people that have that issue, we really want them to come in so we can get a game plan. We can make sure that what you are seeing is melasma versus just sun damage. So that way we can get you the most appropriate plan with the most appropriate technology.
We found that using even another technology called nanotechnology by the name of exosomes or Exovex, it really works incredibly well when we want to make a powerful impact, especially on hard to remove pigment issues like melasma. And so we actually are treating the skin directly with this technology that helps to reverse that damage that's there and allows for even better result in a faster amount of time. So this is really exciting stuff for us. We have a question. April talks about using BBL Plus or Hero on the neck. Which would you use and why?
Oh, that's a good question. So really you can't go wrong with either. The difference between the two is that Hero is quick. So if you want to get in, you want to get out, maybe if we're treating the chest, we use the hero and we come on up on the neck. If maybe we're just treating face, we use the BBL plus and we bring that BBL plus down on the neck. You're not going to go wrong by either one. It's just two different ways to approach it.
When we talk about removing sun damage, I think it's really important that people know that, sun damage, especially for most of us, includes the face, neck, and the upper chest. And so really, you want to, when you think about treating these areas, we really want to extend that treatment all the way down into the décolleté or décolletage area, because of the fact that it's all really one area that's visible most of the time. Same thing with hands. The last thing we want as we move through the years is to start seeing us accumulate sun damage on our hands, but yet our facial skin looks amazing. There's no sun damage and there's a mismatch. So all of that really needs to look the same. And so I know that a big part of our treatment plans, April, is really making sure we're advising patients, especially patients that spend a lot of time in the sun or have over the years, that face, neck, décolleté, and hands are really very important to be treated at the same time.
I agree. That's one of the biggest things. I see people come in and they focus on their face and I'm like, oh my gosh, like your hands, it's a dead giveaway. Like add that on. That's a super simple, easy add-on treatment and it's quick and there's no reason not to treat that.
One of the questions we have specifically around downtime and healing process. And, the important thing to understand is that usually there's really not an open area that has to heal. Now, I will tell you, when we use the vascular laser and we go more aggressive, for instance, when I get treated with BBL, I particularly have issues with blood vessels around the nose, and I have my team be very aggressive with those areas. And sometimes we can see a little area that does bleed or may have a little bit of an opening in the following days. But most commonly, that is resolved 3 to 4 days beyond the treatment. When we're typically treating routine sun damage and really getting that UV damage out of the skin, we call that a social downtime that is variable on what you consider to be downtime. So for me, it's 0 because I go to work and I don't mind going to events and having that brown pigment come up through the skin to the surface of the skin. Doesn't bother me. But for some of our patients, they're really concerned about people noticing that enhanced brown look that happens just in the following few days after treatment. And that is us breaking out and breaking down the sun damage deep in the dermis so that it comes up to the epidermis and your body can get rid of it in the normal process of reepithelialization or epithelial sloughing, which happens every single week and really every day. So essentially that's dependent on you. And many of our patients can cover this by using Elta's tinted sunscreen, the UV Clear tinted, which works incredibly well, or using makeup. It doesn't seem to be a real stopper as far as lifestyle and day-to-day, from what I understand. Would you agree, April?
I would agree. And especially as a woman, I think it is, they want to all know, can I put my makeup on? Can I go back to work? Can I be in social events? You can. I just tell people this, if you have brown spots, they're just going to be accentuated. So for most people that know your face, it's just going to be an accentuated spot. If you've got little like rosy cheeks, they're just going to be rosier for a couple of days. So it's not like you have oozy, weepy, anything like that. You can be socially acceptable after having a BBL treatment for sure.
We've got a question in here about rosacea. How does BBL work when we're really getting rid of that redness, those constantly flushed cheeks, or the vascularity that happens around the nose or the cheeks? What are we targeting here and how are we doing it?
So the redness is caused from blood vessels. And then when we have people come in and we do our specialized camera system, our Vizia camera, it will actually take a picture of those vessels up underneath the skin. And so the idea is that with the BBL, it comes in and coagulates those blood vessels, and then your body reabsorbs them with time. So that first 24 hours after you have a treatment, ideally, we don't want you working out, really getting hot and sweaty to where you're flushing, because we want those vessels to close down so that your body can absorb them. It can take several treatments to get those gone, but it works beautifully for that.
One of the questions that we have is around BBLs or TCA peel when we're talking about removing specific sun damage. And I know my answer on this, which is BBL over TCA any day. And that has to do with what we're able to achieve with light therapy down into the skin. Acid peels are fantastic when we're talking about resurfacing the outer layer of the skin, smoothing the texture, getting a cell turnover. we talk about cleaning up the damage that's deep into the dermis, deep into the dermal layers. To me, BBL does a much better job of penetrating all the way down to the dermis. What are your thoughts on this, April?
I would agree. And the difference between the two is also chemical pills, they're not quite as predictable. I mean, it's all dependent upon the person that is applying those chemicals and how deep it penetrates. We can't regulate the depth of which those go, whereas BBL, it is a specific wavelength. And so we get to choose how deep that goes and where that pigment lies. And also chemical pills, you can look rough afterwards. So the social downtime part of it is a big deal for people because they may not want to go through that peeling process.
What about any skincare products that our patients need to avoid prior to treatment?
If you're on Retin-A, I mean, I typically tell patients if you can go off of that for 3 or 4 days beforehand. Some people don't, but if they can do that, ideally, I would have them go off of that beforehand. Another big one that some people don't think about is certain medications or certain antibiotics we want to know ahead of time. So if you're about to have a treatment, you can always give us a call so we can review those for you and make sure that those are not photosensitive medications.
When we're talking about treating the under eye area, which can be more complex, we've got a question specifically about would BBL be a good treatment for under eye circles or that darkness that develops there in some of us as we move through the decades?
I would say that it's complicated. So it can help that. It can brighten this area by doing, getting some light under there. We do have to be careful how far we can treat up because we also have to make sure that it's a safe treatment. It can make the area look a lot better, but essentially we'd probably want to take a look at you to make sure that what you're seeing and what you're wanting treating so that we can meet those expectations.
I agree with that. I think it's a complex answer, and it sometimes can mean volume replacement. Again, we're working a lot with exosomes now in the lower eyelid area, and this may prove to be a very beneficial treatment for dark lines, crepey skin, those textural changes, and all the other things that we see happen in that area as we move through the years. I've got another Moxie question. Will Moxie treat sunspots? And the question really is, what is Moxie? Can you elaborate on that? Because I know we've talked about it here and there.
So the answer is yes, Moxie can treat spots. It's the difference with Moxie is it's a laser. So you're going to have a little bit, I would say a little bit more downtime, even though I wouldn't say it's significant downtime. You're going to be a little bit more swollen, and you're going to feel texturally different after Moxie. So you're going to feel kind of sandpapery for 3 or 4 or 5 days until that peels off. So that's kind of the difference between how you will look and how you will feel between BBL and Moxie.
Yeah, BBL is sending light energy into the skin, and it's specific wavelengths that target different problems. For instance, for brown, we use a very specific wavelength of light that targets the brown deep into the skin to reverse sun damage. With red, we're using a different wavelength of light that targets the red, but this is mainly enhanced and intense light therapy. And it is very quick. It is a very bright flash of light, and then it's gone. You tend to feel a little bit of heat in the skin when this happens for each pulse. Most of us don't need topical, but some of our patients are sensitive to the feel, and they benefit from having a little bit of numbing medication on the skin. Moxie is what's called half of a halo. I don't know if everybody's familiar with a halo, but halo is a hybrid fractional resurfacing laser that does 2 things. It causes ablation of the skin, so it's resurfacing the outer layer of the epidermis. The second thing is the non-ablative portion or coagulated portion. What that means is it's bypassing the epidermis, what you see and can touch, and going deep into the dermis where it's creating change or heat. So a Moxie is just that second half. It's the coagulated portion. And it really does a great job of cleaning up the dermis, stimulating more collagen and elastin production, more hyaluronic acid production. And that is what's beneficial for Moxie. It allows us to decrease the amount of heat and all delivered to the skin so we can target very complex problems like melasma, which tends to be more hormonally driven and is very sensitive to heat. So we don't want to treat melasma with a bunch of things that generate heat. That can mean BBL and it can mean halo. So we want to downgrade what we do, but not downgrade the effectiveness of the treatment, but use something more specific that targets that problem. Okay, it's a long answer, but I think I hope it was okay. So how long? Okay, this is the question. Um, when can you go into the sun for an extended period of time after your BBL? And I love this question because I did a blog this summer that was all about protected sun exposure. So, I'm a huge fan of I love being in the sun. I do. But protected sun exposure is very different than just, putting baby oil or iodine on our skin and laying outside. What's your thoughts on that, April?
Well, I mean, obviously, I'm going to tell you protect your investment. I mean, if you're going to spend money to do these procedures, buy a good sunscreen. I mean, that's like the easiest, cheapest thing that anybody can do. But as far as going out in the sun after, we live in Austin. I mean, if you live here, you see the sun. So there's no way to avoid it. So put a hat on, put some sunscreen on and enjoy life. I mean, I don't want you going, like I said, to the Bahamas the next day after you have a treatment and you're laying out there catching all the rays. I mean, we like white skin. So, the lighter you are, the more aggressive I can be with your treatment. And so that's really important. I'm more concerned with the amount of sun that you're getting beforehand, because the darker you are, the harder it is for the laser to distinguish, am I hitting sun damage or am I hitting, recent sun that you got? So if you can be really protected beforehand, I can be really aggressive and treat you really well with the laser when you come in.
And aggressive means a more effective treatment to deliver the results that you desire. I would tell you, wouldn't do this within 3 days of a vacation. If you're going to head to the coast or you're going to go skiing, I would tell you give yourself a 7-day, 7-8 day period beforehand. But then just remember, protect your skin when you're there. Sunscreen, hat, glasses, things like that. Be smart. How soon after profound treatment can you have a BBL?
So with Profound for those that don't know, it's our tightening procedure. It's a combination of microneedling and radiofrequency in one. And with that procedure, people tend to get a little bit of swelling, and they can definitely have some bruising. So we really want that to be resolved before we turn around and we put the BBL over the top of that, because it can be counterproductive if you're bruised up. And then the laser can't distinguish, are we treating brown or are we treating bruising? So we want those bruising to be resolved before we do any other procedures after that.
Question is there an ideal age to start doing BBL treatments?
When you start seeing issues, come on in. I mean, everybody's different. If you were really bad in the sun at 16 and all of a sudden you have all this pigmentation or all this damage pop up and you're 23 years old, then it's time to come in. If you've done really well taking care of your skin and you're not really seeing anything until you hit 30, that's okay too. But a lot of what's nice about BBL is it also does a little bit of prejuvenation. So even for those people or those younger patients that are looking to prevent, they say, I don't want to look like my mom, I don't want to look like my grandma, then those patients are okay to come in and start in the early age as well.
I think it's also important to understand that BBL can also be used with what's called BBL clear settings that help us to really decrease the bacterial colonization of the skin and can help reduce acne. And I think that's a really important concept to understand, because a lot of times we see acne not only in the face but in the back. And we can actually use BBL Hero with the clear settings in order to be able to really help improve areas like that. I think that's really important. Another application is someone who is maybe younger in their teens, early 20s, that may still be struggling with that. This could be something that can help us get under control, or adult onset acne, right? These are all real things. We've got a question about, have we had BBL, and to tell about our experience. So I've had BBL of the shoulders, the face, and the neck. I typically get a treatment of the face and the neck every 3 months. That's very important to me, and including all of our staff. It's something we do once a quarter, and we just started getting back onto our quarterly evenings. This is a new program for us, for our entire team. So after hours, usually on early in the week, we will stay for a few hours and take care of each other. And that's how much we believe in this technology, that we want all of our team to have BBL Forever Young and BBL Plus, BBL Hero exposure, because this is, we know, the single best thing you can do to help stimulate collagen elastin production and reverse sun damage, right? It's the thing that cleans up our skin no matter how active we are, how busy we are in the sun. So that's my experience. April, what's your experience?
So I have had BBL. I can vouch that I deal with melasma. So I've done some experimenting before on doing BBL on my face with melasma, and it didn't get me the results that I was looking for. I love BBL for my neck, for my chest, for my arms, for my hands. It works amazing for that. I typically stick to doing Moxies or Halos for my face, just because I do deal with that melasma portion of it. So.
We got a question about pain. I know we talked a little bit about pain earlier. Can you tell me a little bit about how do you talk about that?
So honestly, people get through it just fine. I mean, I have a handful of people that may need to do some numbing cream beforehand, but for the most part, with the way the technology is, the crystal itself is cool to the touch. So it's cooling down your skin at the same time we're putting heat in there. It's a fairly quick treatment. So most of the time people handle it really well. Like I said, I don't have that many people that have to do numbing, and the only issue with doing numbing is for those people that have rosacea or redness. Sometimes the numbing alone can make people more red before we actually treat you. So that's why we don't typically just numb everybody off the bat, but it is an option if we do need it. But for the most part, it's fairly comfortable.
I think the thing to understand is this is something that's more startling than it is discomfort.
Right.
So it's just such a quick, bright light, and it's super intense. You're like, oh my God, like there's another one, but it doesn't necessarily really hurt per se. It's just kind of like, oh my gosh, when's the next one coming, right?
Right.
So, but it's kind of a startling, bright flash. I've got a question here. Can you have BBL plus a treatment at the same time, like Moxie or Halo or microneedling? I can talk about this for a second. My favorite combo treatments are BBL followed immediately by microneedling with exosomes in the practice right now. And before that, it was BBL followed by microneedling with growth factors, or BBL followed by Halo. So I like doing stacked combo treatments. To me, that is really awesome because I'm there. I can get everything done at the same time. What's your philosophy on that, April?
I love it because you have one downtime. So if you want to treat pigmentation, but you also want to address fine lines, wrinkles, texture, I love combining BBL with Halo or combining BBL with Moxie, depending on what we're trying to treat, followed by some exosomes or growth factors or whatever that is, depending on the patient. But that is one of the best, most favorite treatments, I would say, is combining BBL with another treatment on the same day.
What about with regards to Botox and filler timing? How does that work?
So if we're going to do just the BBL by itself, we do the BBL first, and then we can follow it with injectables. So we can do your Botox and we can do filler even the same day, as long as you don't have too much puffiness with it. People that are maybe super red and maybe we couldn't inject their cheeks that day, but if they wanted their lips done, they could totally have their lips done that same day. With some of the other treatments such as Halo and stuff, it's a little bit more, I wouldn't do injectables on the same day. I would push those out a couple of weeks.
What about with regards to a question specifically about rosacea and rosacea flare-ups? Can you do BBL during an exacerbation of rosacea, or do you need to wait until you're back into a quiet phase?
You can treat during that time. It just might be a little bit more uncomfortable because you're already flared up. And so we're turning around and putting, this kind of spicy little snap of a procedure over the top of it. So I would say that's probably a per patient judgment to make. It's not that it can't be done. It's just that it might be a little bit more uncomfortable.
What about with regards to staying out of the sun? We talked about that one. This was specifically, can I do these treatments in the summer months?
If you are having protected sun, yes. I would say, If you're somebody that you work from home, you're not outside all the time, you're using your sunscreen, you're still kind of going to your kids' ball games or this or that, you can come in and do these treatments. If you're somebody that you're an outdoor fisherman and you're outside all day, every day, then maybe the best for you might be waiting until the fall or the winter when you're not quite as dark.
What about the need for continued treatments, our recommended treatment plan? And what if you stop doing your BBL treatments? Then what happens?
I tell everybody we're all going to continue to age. We can't fight time. So ideally, yes, we keep you on a maintenance plan. We like you to come in, and talk about a yearly plan, so that way we can keep, your optimize your treatments. But if you stop and it's a couple years before you come back in, that's okay too. And if it's a financial reason or you move away or whatever that reason can be, you can always just pick up where we stopped. But we may have to go back into that corrective phase versus a maintenance phase.
What about avoiding areas where there's been a history of skin cancer, like basal cell carcinoma or something like that on the face? Is that an issue at all?
Well, we definitely want you to make sure that you're following up with your dermatologist. If you're having any active current cancers on your face, obviously we don't want to treat over the top of those. But if those have been addressed and you have had treatment on those areas, and maybe you just have some residual redness post maybe an excision of something or a Mohs treatment or something like that, we can treat over the top of that area to get rid of some of that remaining redness.
It definitely helps in areas where their scars are pink or red, and we typically will use BBL with the red settings specifically on early post-surgical scars. And many of our patients starting 4 to 6 weeks out will treat those areas. And so it can be used to treat scars even from a skincare and cancer excision. Following up with the cancer thing, I know there was a question regarding about whether or not it reduces the incidence of skin cancers. And I'm not sure if there's a study to date that supports that finding, but I have reached out to a dermatology colleague of mine to see if she knows of anything at all. But I don't believe it reduces the incidence. It does clean up the damage that's occurred because of sun exposure, but it may not stop a cancer from developing. Okay. Do you know anything on that, April? Is that a topic you've had to talk about before?
Yeah, no.
It's I will follow up. I know who asked this question. I will follow up with you on this, but I'm pretty certain that there's no published study that supports that claim. Does BBL affect tattoos? And I think we could be talking about tattoos on the body if we're using BBL Hero, or even permanent makeup, tattooing on the face, brows, eyeliner, things like that, lip liner.
So we avoid those areas because the BBL can pull out the pigment inconsistently with BBL. There are specific lasers out there that are made specifically for tattoo removal. However, BBL is not made for tattoo removal. So we avoid, hitting over the eyebrows, or if somebody, we're treating arms and they've got an arm tattoo, we avoid those areas.
We've got a question here. April said on the video, we are the busiest single practice for BBL out of Austin, San Antonio, and the state of Louisiana, the entire state, which is insane to me. And part of the question is, if I don't live in Austin, if I live in Houston or live in San Antonio, can I do a virtual consult? And the answer to that is yes. We have a telehealth platform that we utilize for virtual consultations, and we do them for both surgical and non-surgical procedures. And that can be a great way to learn more about your skin. We would have you take some photos for us so we could review ahead of time. But ideally, we want to do a Visia scan with our system to better look into the skin. A Visia skin analysis is the best technology in the world when imaging skin. It does a few things that help it be the very best. One, it controls for the light settings. So we know exactly every time your photos are taken, it's exact same light settings. Second is the head position is the same. And that's really important when we're talking about creating standardized images, but we can use these images to go back and compare where you were before we started your treatment plan. Our philosophy is that creating an annual skincare plan. We can change your skin with one treatment, but our goal is to really create a year-long program to take you from point A to your desired goal, point B, and create a very steady treatment plan to get you there. And that's been our unique process for the last few years as we've really cultivated an intense skincare rejuvenation and restoration program. So I think that's really important. I've got a question about good treatment for skin with big pores and oily skin. What are your thoughts on that, attacking that concern?
I think that's kind of multifactorial as well. Sometimes just good skincare. And then also, I mean, there are other treatments I think will probably be a little bit more effective for this, such as microneedling or even halo. And then also getting on some good skincare to control the oiliness of your skin.
Question here is, does it matter how old you are? For example, after 65 years old, is this treatment possible?
Absolutely. Absolutely. If you've got spots, you've got pigment, we can treat it. Age is just a number when it comes to BBL.
Can BBL improve skin texture like a halo?
To a certain extent. Anytime you're putting heat in the skin, you're going to get some collagen stimulation. So with the BBL, there is a little bit of that collagen stimulation. Is it going to do as much as a halo? Probably not. But if you do them in combination, it's a great treatment.
I've got a question here about immediate post BBL treatment. Will my face look like I've had a treatment right after I've been treated? So like, let's say I needed to jump on a Zoom call for work or a meeting. Am I presentable to do that? I mean, what does that look like?
I would say yes. Put on some tinted sunscreen and some mascara and go about your way. You're going to look a little bit flushed if you're treating red. Anything that's brown is going to get browner over that first 24 hours. So you yourself are definitely going to know that you had something done, but outwardly to other people, they may not notice.
Is there any contradictions or patient profiles besides melasma that you would not recommend BBL? So any type of patient condition that we would not recommend BBL?
I would say skin type really is dependent upon, we can treat skin types 1 through 4 essentially with BBL. That means the darker the skin is, it can be more difficult to treat. That's when we really want to just come in and lay eyes on you and make sure that it is safe for you to do.
So we're really talking about patients who have Black or African skin type, African descent, Black skin, Asian skin. Those tend to be the higher level Fitzpatrick's, and we have to be very careful because we do not want to cause hyperpigmentation, right? The exact opposite of what we're trying to achieve. In these situations, Moxie is a very good way to clean up the deep layers of the dermis because it can be used on all skin types. And that's really an incredibly diversifying treatment. And that's very important for us and why we acquired this technology for our patients, because we knew we needed something that didn't discriminate at all when it comes to skin type and being able to really create an effective outcome. Let's see, how long does a treatment for the face or neck take to be completed?
Less than 30 minutes. It's actually a fairly quick treatment. Sometimes it takes us longer just to do paperwork and photos and get you all set up than it does to actually do the treatment itself.
We've got a question here about pricing. How does the price work per area?
So we have special event pricing for tonight, so I can review those for you. So let me get my little cheat sheet here. So one of our event prices is called our Gift to You package. We are offering 3 of our BBL Plus treatments that include your face and your neck for $1,650. So $1,650. And then we're also offering a package that's called One for Me and then One for You. So if you have a loved one or a friend that you want to gift something to, where you can purchase a second package for $1,500. And that will also include 3 treatments, and that's the face and neck. And then lastly, if you want to add on any of these other procedures that we've been talking about, whether that's a halo or a Moxie, we're also offering 20% off regular price on that. And if you want to get a hold of the office, we can go over those specific prices with you.
So our intention with setting this up was to be able to create something that would allow you to have a treatment about every 3 to 4 months through the year. and be able to, at a reduced price that would allow you to be able to continue, amazing skincare changes, reversing sun damage, and causing youth activation gene transcription in cells over the course of your 2022 year. And hence why we did this in December in preparation for us to get started in January with your treatment plan. Again, part of our unique process is really setting up an annual program that makes sense to get you from point A to your desired goal, point B. That is a huge part of our program because we truly believe in having a lifetime relationship with you. Are there any other questions that anybody has? Please enter them in the chat box. Otherwise, we'll move to conclude this evening's presentation. We really appreciate you for watching this evening. We know this is your personal time, and we greatly appreciate you taking that time to join us tonight. Please remember, you're going to get a text and reply yes to be contacted for a consult, and our team will reach out to you in the coming days so that we can set something up and get you in for your complimentary Vizia skin analysis and go through the treatment package and go ahead and create your annual skincare plan. So thank you very, very much.
Yes, thank you.
Hope you have a great evening.
Look forward to seeing everyone. Bye, guys.
Bye-bye.